Hi, my name is Morgan, and I'm really excited to be applying for this clinical experience at Denver Health. First of all, thank you for taking time to review my application. I really appreciate your dedication to us students. I really feel I'm able to remain flexible in a clinical setting and stay calm and confident when unpredicted situations can arise. My past and current experiences in the inpatient setting have allowed me to practice and kind of refine my ability to be flexible. Whether it's, for example, being willing to shift focus to lend a hand to a colleague when a chaotic situation arises, or being creative and problem solving when a patient, say, doesn't speak the same language as I do, or being flexible in how I approach the plan of care with a patient because maybe, say, they really don't have any social support. Additionally, as I continue finishing my EMT certification and gain experience in this realm, I'm continuing to advance my ability to be flexible because, especially in this area of medicine, there's really very little predictability. Some of the strategies I use to be flexible and successful in the clinical environment include being as prepared as I possibly can and practicing important skills often. Preparing by reviewing the patient charts in detail, if at all possible, allows me to have a good understanding of the knowns. So when unpredicted situations arise with the patients, I can adapt based on the knowledge I already have. I also find practicing important skills often allows them to become a bit more muscle memory when I can really need to adapt to a situation quickly. I believe I thrive in a fast-paced environment, and I'm comfortable with the equipment and setting of a hospital. And I also work well and understand the roles of the interdisciplinary team in the inpatient setting. I also have multiple experiences and a really big interest in serving and advocating for underserved populations, which I know is really important to best serve the patient demographic at Denver Health. From my clinical experience in a very rural hospital to assisting with underserved youth hippotherapy sessions, I'm super eager to continue advocating for patients that sometimes just need more providers in their corner, advocating for both their physical and emotional health. In my first rotation, my CI noted that I could sometimes improve my efficiency in my new patient evals, and sometimes I was taking just a bit too much time to get history before completing the necessary tests and measures. I accepted this constructive feedback by reflecting on what I had done in my previous patient eval, made a plan, asked my CI clarifying questions as needed, and then verbalized my plan with my CI just to check my understanding. If selected for this opportunity, I would openly communicate with my CI at the beginning of the rotation about my preferred method of feedback while also listening to their preferred method of giving feedback. Then I would continue to keep that open line of communication and make improvements to our system if needed. I know CIs are busy practitioners, so I would definitely work with them to make an efficient system for us. If selected for this clinical education experience at Denver Health, I would definitely review in detail content regarding management of acute conditions and reach out to my close mentors that can help guide me to success in this setting. I've been successful with course material covering these related topics, so I'll just continue to retain and advance this knowledge. I also have mentors that I work with currently that also work in the acute care setting that I would definitely reach out to for specific advice and guidance. I will also be taking the Neurological Management elective course at Regis before beginning this clinical, which I'm excited for to advance my knowledge of the patient population that is often seen in acute care. I was born and raised right here in Colorado, and with family deeply rooted in this community, I plan to stay in the Denver area after graduation. My goal after graduating is to work in an inpatient setting, and honestly, starting my career in a fast-paced Level 1 trauma center acute care setting like Denver Health would be a dream. Thank Thank you so much for considering my application. I'd be honored to have the chance to learn from and contribute to the Denver Health team.